So let me just check, am I audible so that we can start the session? Okay, my dear aspirants, let me just check. Yeah. So yes, those who are joined live, let me just know, am I audible or not? Okay. So today's session is of histology of the blood vessel. So this is targeted about the histology of blood vessel, which we are going to cover up in this session. Already the general anatomy part has been done in the previous session, and today we are just talking about the histological aspect. Okay. So yes, my dear aspirants, am I audible? Okay, yes, I am audible. Everything is fine. So yes, my dear aspirants, okay, the students targeted, this is very useful for the first and second year aspirants to know the general histological aspect of blood vessels. So in this, we are going to detail about the histological identification point for the large arteries, that is elastic artery, muscular artery, arterioles, veins and venules, and also the different types of the capillaries. So this is targeted for the first year MBBS students, histology of blood vessels. So my dear aspirants, Dr. Monalisa, myself Dr. Monalisa, MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss the histological aspect of blood vessel. Before starting the session, let me just brief you quickly about the free platform of Unacademy. So special class features on the Unacademy platform, which is absolutely free for you, is a unique platform where you can be joining the session. You can have an interactive live session with the learners. So learners will be there, and you can the learners and the educators can interact among themselves. Polls are conducted which are highly beneficial. The aspirants can respond to the poll, raise your hands, get your doubts clear right itself in the session. Never ever miss a session. So never ever miss a session. What does that mean? That means that when you start liking the session, okay, for example, if you start seeing my session and you are liking it and you want the PDF notes of that session, so what you can do, you can follow me on the Unacademy app, and thereafter actually there is a communication guidelines is there in the app where the students can directly get in touch with the educator, and you can message also. That all benefits are there on the Unacademy app. So you can download the Unacademy app and you can be able to present live for the free sessions on the Unacademy. So lecture notes and PDFs can be downloaded once the session is finished. Attend anytime, anywhere, and read from the top educators of Unacademy platform at your own place. Now, the students who are downloading the app for the first time and they want to get enrolled for that session, so they should use the code ANAT10 and be present for the session. Now, let's talk about free special classes. What are the features of free special classes? So, my dear aspirants, I just want you to give an information. What are the upcoming free sessions of my own session? So, I am going to take 2 sessions on 26th January, Republic Day पे हम 2 sessions लेंगे free platform पे Unacademy पे, that is on Wednesday. And what is the topic which must be known to you is high yield MCQ. This is for targeting NEET PG 2022 examination. So high yield anatomy MCQs will be discuss. The aspirants should be present for this session. This will be highly beneficial for you, and this session is occurring on the Wednesday 26th of January, 1 p.m. and 3 p.m. Two sessions are there, my dear aspirants, 1 p.m. and 2 p.m. So do present live for this session. Use the code ANAT10 to get 10% discount if you want to take the plus subscription, and you can use this code ANAT10. So you can use this code as an unlock code for the free sessions of Unacademy platform. My dear aspirants, I would also like to discuss the free test calendar of medical PG examination के लिए. Why not I share the whole calendar with you? So let me slightly enlarge this image so that you can have a better look of all the calendar, free test calendar. So when you want to know the details, you can just pause the video and you can see it afterwards, the details. So 13, 17, 22nd, 28th January is the educator curated test series. Every Friday 9 p.m. study with me. The test series is there. 9 January alternate Saturdays NEET PG 22 grand test series. 16 January alternate Sundays is FMG 22 grand test every Saturday. So my dear aspirants, all the days and all the schedule of whole entire month of January is already discussed with you, and you can just go through this, and whichever test you want to enroll, just enroll by using the code ANAT10 and do present in this free test. This is a highly beneficial thing for the aspirants and the students because it is all present on the free platform. So just grab this opportunity, my dear aspirants. Now, and as I told you, use the code ANATED to get enrolled for all these free tests. Okay. Now let's talk about the plus platform. फिर अभी आपके पास डाउट होगा कि ठीक है फ्री प्लेटफॉर्म तो बहुत यूजफुल, व्हाट अबाउट द प्लस प्लेटफॉर्म? द प्लस प्लेटफॉर्म इज एग्जैक्टली द अनअकैडमी का जो प्लस प्लेटफॉर्म है, वहाँ पे all 19 subjects which is required for competing in the next exam for the next and for INICT and all, these all things are completed in a very systematic way. Okay, so that you are going to study in a very systematic way. You can study from top educators of Unacademy platform. Every fourth session is a doubt clearing session. Live test and quizzes में आप participate कर सकते हो. Study on the device of your choice. You can access more than 25,000 MCQs, and with soon you will be provided with the printed notes of Unacademy. So all these benefits can be catered by you. You can use this code ANAT10 and you can be present for this plus subscription. And if you are using this code ANAT10, you will get an extra discount of 10%. So just go for plus subscription. अभी एक दूसरा subscription है, that is iconic subscription. So when I am talking about iconic subscription, it means merging of two best platforms, my dear aspirants. One is the Unacademy, another is the Prep Ladder. You will get the benefits of clinical integrated essential sessions, video lectures of the dream team of Prep Ladder, QBank 3, रैपिड रिविजन, स्नैपशॉट, ट्रेजर, ड्रीम नोट्स ऑफ 2021. सो माय डियर एस्पिरेंट्स, ये सारे बेनिफिट्स जो है प्रेप लैडर के, ये एड ऑन बेनिफिट्स है. सो दैट मीन्स यू गेट द बेस्ट ऑफ द टू प्लेटफॉर्म. सो जस्ट गो फॉर इट. इफ योर टारगेट इज नेक्स्ट एंड नीट पीजी, यूज दिस कोड ANAT10 to get 10% extra discount. Now I would also like to share this image. Congratulations to FMG December session 2021. I am very delighted to share their images and I wish them good luck so they can crack the NEET PG examination in the first attempt. All my good wishes are with them. So now this is the NEET PG subscription plus an iconic pricing detail. You can go through it. You can get an extra discount by using the code ANAT10. And I would also like to inform you that not only this, on the platform of Unacademy, we have got more than 25,000 high-yield clinical MCQs from all 19 subject, my dear aspirants, based on the latest pattern of examination, and it is also including a detailed description given by the top educators of Unacademy platform. So just grab this opportunity, use this code ANAT10 and get 10% extra discount. Now, I would like to share a very important information with you, that is Republic Day special, 26th January. So starting from today itself, my dear aspirants, tomorrow, sorry, I'm so sorry. Starting from tomorrow, that is 25th Jan and ending on 27th Jan, use the code ANAT10 and get an extra discount as a Republic Day special offer. So just grab this opportunity, my dear aspirants, and use this code and take the subscription. 6-month free extension is there. So what is the benefits? So 10% discount added on with 6-month free extension. So this is a great opportunity. Republic Day special, 6-month extra free extension. I would like to exaggerate this point. Why? Because this is a golden opportunity. Those who want to take the plus subscription, applicable on 1 year and above subscription. If you are going to take 1 year and above subscription, you are getting 6 months absolutely free. So just go for it. If you are planning, this is the right time to target the plus subscription. Now, what are the batches which is going on and started right now? The two batches, Focus FMG batch 22 and Target NEET PG 22 batch, that is also targeted. So that is also targeted for the next exam. So the aspirants who are in the first year MBBS, what I want to tell, that you have to start your preparation of next right itself. So when you are going to take the plus subscription, it's not only the next and NEET PG or INICT preparation or FMG preparation, it's all about the Prof exam preparation, that is university exam, which is gone through the comprehensive classes which is taken on. So just grab this opportunity, take the subscription, 1 year of subscription, getting 6 months free, and use this code ANAT10 for extra 10% discount. So my dear aspirants, आज का टॉपिक हम स्टार्ट करते हैं, हिस्टोलॉजी ऑफ ब्लड वेसल्स. सो लेट्स स्टार्ट विद द टॉपिक. ऑल द बेस्ट माय डियर एस्पिरेंट्स. So already अगर मैं बात करूँ general anatomy of blood vessels, so this session has been already taken by me on the Future Doctors platform of Unacademy. Okay, already we have discussed that. Histologically अगर हम बात करें blood vessels को, so we already know blood vessels are delivering oxygen, nutrients and hormones and cells to the body and remove the metabolic waste products and carbon dioxide from them through the blood. So actually the exchange takes place, and this exchange takes place between the arterioles and the venules at the level of capillary. So capillary is called as exchange vessel. So I'm not stressing much on this point because general anatomy में मैंने ये सारे points बहुत detail में बताए हैं आपको. So it's already has been done. Let's focus on the histological aspect. So if I talk about the histological aspect, that means general structure of blood vessels. So firstly what I will do, I will go systematically with the general structure of blood vessels. That general structure of blood vessel की बात करें तो it is histologically having the 5 main types of blood vessel. Arteries are there, veins are there, arterioles, capillaries, venules are there. So I am going to tell you about the facts of the histological aspect of all these structures, how we are going to identify what are the key points to know about each of this structure. So we will go about that. So firstly I just want to tell the general features of blood vessel. Agar general feature of blood vessel ki baat kare, so we have got 3 layers as we move from inside to outside. Okay, so let me just enlarge this diagram. See here. So if I am enlarging this diagram, see here. Yeah, got it? So see, if I am enlarging this diagram, what you can see, this is the luminal. Okay, what is this? This is the lumen. Okay, this is the whole lumen of the blood vessel which you are seeing. Okay, and starting from inside to outside, the layers are, if we talk about inside to outside, the layers are, we are getting tunica intima is the innermost layer, the second layer is tunica media, and the outermost layer is tunica externa. So we have got the innermost layer as tunica intima, then we have got tunica media, and the outermost layer is called as tunica externa or tunica adventitia. Now, subsequently, what is the brief or important points about this layer? So when I am talking about that, अगर हम intima की बात करते हैं, that is the innermost layer from the luminal aspect, from the lumen से हम बात करें तो that is consist of endothelium and subendothelial connective tissue. There is 2 layers which is separating. So can you see, this is an internal elastic lamina which is separating, internal elastic lamina is separating tunica intima with that of media, and tunica media is separated from that of the externa by external elastic lamina. So these are 2 layers which is separating the 3 layers of the blood vessel. So let's talk about individual aspect. So let's talk about general feature of blood vessel, and then we will go with the individual aspect of the entire great vessels and veins. Okay. So my dear aspirants, let's move on with this. General features. So all blood vessels have basic structure, and it is important to know the basic structure. So what I told you, the innermost structure or the innermost layer is tunica intima. All those aspirants who have got any doubt, they can ask me right itself, nothing to worry. They can just clear their doubt right itself during the session. Tunica intima, if I talk about, it is the innermost layer as we move from the inside of the lumen to the outer aspect. It is composed of, it is having a lining endothelium. It is consist of lining endothelium which is made of simple squamous epithelium. It is made of simple squamous epithelium. Okay, it is the lining epithelium which is made of simple squamous epithelium, and this simple squamous epithelium is resting over another layer that is called as subendothelial connective tissue. It is resting on subendothelial connective tissues. Okay, this is the innermost layer. Now let's talk about the tunica media. Tunica media, when we are talking about the tunica media, this is the intermediate layer, and this tunica media is the layer which is composed of smooth muscles and also with the connective tissues. Actually, it is having mainly the smooth muscle fibers are residing inside, smooth muscle fibers along with the connective tissues. And what is the outermost layer? The outermost layer is tunica adventitia. Third layer is the tunica adventitia. So when we are talking about tunica adventitia, which is also called as external layer because it is lying in the outermost wall layer, it is mainly composed of fibroelastic connective tissue. It is mainly composed of fibroelastic connective tissue. Okay. So if I talk about general arteries की general terms की बात करें तो arteries are thick walled blood vessels that is carrying blood from the heart to that of capillary. So in general, if I talk about general terms which is applied for the blood vessels, if I talk only about the arteries, अगर मैं arteries की बात करूँ, so firstly we will discuss the arteries. So arteries are thick walled as compared to that of veins. They are thick walled, and these blood vessels carry blood from heart to the capillaries, to the capillaries. Now I would like to describe, thereafter I would like to describe the individual different types of arteries, and in this category I would like to describe the great arteries, large arteries, which is also called as elastic arteries, and then the muscular arteries. Okay, so here is a diagram which is showing the elastic artery. So this is exactly how under the microscope the elastic artery looks. Okay, so as you can see in this diagram, the elastic artery 10x is the power on which the histological image has been shown to you. And let me just highlight this diagram. अगर मैं इसको highlight करती हूँ, okay, see here. So see, actually elastic arteries is quite large, so when we see it in 10x also, the whole of the slide is not able to be seen. So see here, let me just highlight it. Okay, so अभी आप देख रहे हो, so the innermost layer which is clearly seen in this diagram is tunica intima, and this is tunica media, and this is tunica adventitia. So one thing which you can see clearly here is the thickest layer. Which is the thickest layer? कौन सा लेयर सबसे थिक है? अगर 3 लेयर है, अगर ब्लड वेसल्स में 3 लेयर है, इलास्टिक आर्टरी में फ्रॉम इनसाइड टू आउटसाइड 3 लेयर्स है, ट्यूनिका इंटिमा है, ट्यूनिका मीडिया है, ट्यूनिका एडवेंटिशिया है. सो विच इज द मोस्ट थिकेस्ट लेयर? द थिकेस्ट वन इज ट्यूनिका मीडिया, विच इज क्लियरली सीन इन दिस डायग्राम. Okay, so actually here you can see a line is there. Actually this is very irregularly, not very much specific. This is internal elastic lamina which is separating tunica intima and tunica media. Actually why it is not so much clearly seen or visualized? Because it is full of elastic fibers. So entire slide is having elastic fibers, so the refractile nature or this elastic fibers or internal elastic lamina is not visualized very clearly. Same way external elastic lamina bhi present hai, but it is not visualized very clearly when you compare it with the muscular artery. So अगर हम muscular artery देखते हैं तो internal and external elastic lamina is very clear. Okay, the thickest layer is tunica media, as you can see. So first thing is that elastic artery का example कौन सा है? Which are the arteries which is considered as to be elastic arteries? Okay, I will move on with the muscular artery. Before that, I just want to give you the details of elastic arteries. So let me just write few points about elastic artery. I should rub this and give you the details of elastic artery. So you can write here elastic artery. So just in the diagram also we have seen. So अगर मैं elastic artery की बात करती हूँ तो that is present in large artery. So can anybody give me the example of large arteries? When we are talking about large arteries, which are large arteries? Large arteries. So the example of large arteries are, example will be, they are actually the aorta and its branches are large arteries. Aorta, arch of aorta and its branches are large arteries, and actually they are also called as conducting arteries. They are also called as conducting arteries or large arteries. Now my dear aspirants, अगर general features की बात करूँ तो it is conducting blood from the heart, and its thickness, if we talk about the thickness of elastic artery, it is approximately 1/10 of the luminal diameter. So it conducts blood from the heart, and the thickness of the wall of elastic artery is approximately 1/10 of the lumen diameter. It is having a wide lumen, okay, and it is, अगर उसकी thickness की बात करें तो it is approximately 1/10 of the luminal diameter. Now the other important point is that it's also designated by the word elastic artery, means it is having elasticity. If elastic artery is having elasticity, means it is consist of elastic fiber. So elastic fiber will be present. Okay, so that is the another point which I want to mention. Elastic fibers will be present. So presence of elastic fiber. The presence of elastic fibers are there in the walls of the elastic artery, and that allow to expand during contraction. That is called as during contraction, that is allowing the expansion during contraction, that is systole, and to recoil, and it will recoil during the diastole of the heart. So this is one of the important property, and because of this reason they are also called as the conducting arteries. Why? Because of this property they are also called as the conducting arteries. Okay, so I am just visualizing that all the students are Listening or not? Okay, so let me just any of the students who have got any doubt in understanding, you can write in the messages. Okay, now let's talk about the other features. So let's talk about the layers in just brief. Okay, this is the elastic artery, and let me talk about, so yes, here also I will utilize this space, and we will talk about the general features. So let's talk about the general features of the elastic arteries. So here also I would like to write the heading elastic artery. So let's talk about the layers. Okay, the layers which we have seen: tunica intima, tunica. So we have talked about tunica intima, we have talked about tunica media and adventitia. What are the basic features of this? So अगर हम tunica intima की बात करेंगे तो it is consist of endothelium and subendothelial connective tissue. This subendothelial connective tissue is also containing structures like fibrocytes, macrophages, smooth muscle cells. Actually, along with it, it is also containing elastic fibers and longitudinal collagen fibers, which is longitudinally arranged. So let's talk about tunica intima layer. Tunica intima layer is consist of endothelium. The lining of endothelium is simple squamous epithelium. What is the lining epithelium for endothelium? It is simple squamous epithelium. It is simple squamous epithelium, and along with endothelium, it is also having subendothelial connective tissue. It is having subendothelial connective tissue, which is also containing macrophages, smooth muscles, and fibrocytes. Okay, so it's like, let me write it clearly: smooth muscles and fibrocytes. Smooth muscles and fibrocytes. So is my writing okay? Can you understand it? Please let me know, my dear aspirants. Okay. Along with it, it also contains collagen fibers and elastic fibers, which is arranged randomly oriented in different directions. So along with this, this is one basic feature. Along with it, it is also containing elastic fibers. It is containing elastic fibers. It is containing collagen fibers, which is oriented longitudinally in different directions. Okay. Now, the other thing and very important thing is tunica media and that of tunica media and that of tunica intima. These two layers are is demarcated from each other, and the demarcation is done by IEL, that is internal elastic lamina. So this is present, positive, but not so visible. ये present है, but it is not clearly visible. And the reason, this is a key point, please understand that if you want to differentiate a slide of muscular artery with that of elastic artery, internal elastic lamina is the layer which is made of elastic fibers, which is differentiating tunica intima and tunica media. So it is more clearly visible in case of muscular artery because the content of elastic fibers is less. Okay, so it is but not clearly visible, as compared to muscular artery. This is an important point. Now, what is the next layer? Tunica media. When we are talking about tunica media, the second layer, so tunica media is consist of 40 to 70 layers of smooth muscle, 40 to 70 layer of fenestrated elastic lamina, which is also containing elastic laminas and which is also containing smooth muscles, and also outer elastic lamina will form external elastic lamina. So it is also present but not so clearly demarcated. Other important points is इसका demarcation clear नहीं. It is also present but it is not clearly demarcated. What is the outermost layer, my dear aspirants? Outermost layer is tunica adventitia, and tunica adventitia, as we know, is composed of fibroelastic connective tissue, and in this fibroelastic connective tissue we have got blood vessel, we have got nerves, we have got lymphatics, we have got vasa vasorum. What is vasa vasorum? So it is also containing vasa vasorum, and vasa vasorum are there for providing nutrition to outermost layer of the tunica adventitia, outermost layer of elastic artery. So let me explain once again here. So when you see this slide, elastic artery में जो outermost layer है वहाँ पे small vessels होंगे, that is called as vasa vasorum, and this vasa vasorum has got a role of giving blood supply, nutrition. Actually they are providing nutrition to outermost layer, and the thickest layer of tunica media it is 3 times thicker than tunica adventitia. That means if we go in a ratio of TM ratio TA, that is the ratio, so 3:1. So tunica media is 3 times in thickness as compared to tunica adventitia in case of elastic artery. So this is very important for your MCQ session. Done. Let's move on to the next one, that is the muscular artery. So yes, let's talk about muscular artery. Muscular artery means medium sized arteries, distributing arteries, इसको बोलते हैं हम distributing arteries. Sorry, the branches of external examples अगर हम बोले, which are the example of muscular artery. So the branches of external carotid artery, the branches of radial artery, the branches of ulnar artery, all these, the branches of brachial artery, all these are the branches of muscular artery, popliteal artery, all these are branches of muscular artery. The thickness of the wall, if I talk about, it is 1/4 of the luminal diameter. So here the thickness of wall is 1/4 the luminal diameter. Okay. So यहाँ पे भी layers को हम study करेंगे. The innermost layer is tunica intima. So when we are talking about tunica intima, it is mainly consists of endothelium. There is no subendothelial connective tissue, and it is having a very clearly visible internal elastic lamina, which is marking the demarcation between tunica intima and tunica media, which is quite visible, clearly visible in case of muscular artery, because number of elastic fibers are less, amount of elastic fibers are less in muscular artery as compared to elastic artery. So it is consist of endothelium. It is consist of endothelium, no subendothelial connective tissue, no subendothelial connective tissue, and IEL plus IEL. What do you mean by IEL? EL, internal elastic lamina. It is having internal elastic lamina. So I just want to give you detail of internal elastic IEL. What is internal elastic lamina? It is internal elastic lamina, and if you will see in the histological image, it is actually in the form of refractile membrane. So it will be appearing bright refractile membrane, refractive like membrane, and it will be wavy. It will be wavy folds. Why it is appearing wavy fold? Due to contraction of smooth muscles, due to reason of smooth muscle contraction, due to smooth muscle contraction which is present in tunica media. So that will make it more refractile, wavy in appearance. The internal elastic lamina. This is the key feature of tunica intima, differentiation from tunica media. Now which is the second layer on the muscular artery? तो second layer की बात करें, that is tunica media. So tunica media में अगर हम बात करें, the basic important features which is seen. So tunica media is having smooth muscle layer which is approximately consist of 40 layers. So it is having smooth muscle layer approximately made of 40 layers. It is also having elastic fibers, not a issue. It is having elastic fibers, but the number or the quantity of elastic fibers is less as compared to conducting vessels or elastic arteries. Few collagen fibers are also there. Few collagen fibers are also there. Few collagen fibers are also there. Okay. And smooth muscles तो मैंने पहले बोला ही है. Tunica adventitia. Tunica adventitia is the actually it is made of, when we are talking about tunica media, is demarcation from tunica adventitia. It takes place by external elastic lamina. So what is it? It is done by which lamina? It is external elastic lamina. And if you will see the thickness of tunica media ratio tunica adventitia, it will be approximately 1:1 in case of muscular artery. Okay. So, and this is made of collagen fibers. Tunica adventitia is made of collagen fibers. It is having elastic fibers running in different directions, loose areolar tissues. in which we have got nerves, vessels, and here also outermost part of a big muscular artery can have vasa vasorum. So vasa vasorum is for giving blood supply or nutrition to outermost layer of the tunica adventitia. So these are the basic features. Okay. Now unmyelinated nerve fibers are also residing in tunica adventitia layer. Now see this diagram which is showing you the muscular artery. So let me slightly enlarge this diagram. So here in case of muscular artery, a very beautiful lumen is visualized. Okay, and what I told you, a refractile nature of the internal elastic lamina. Can you see here the refractile nature of internal elastic lamina is visualized. This is the internal elastic lamina, IEL. Okay, so this is TI, tunica intima, this is tunica media, and this is tunica adventitia, TA. Okay, so outer here also a external elastic lamina is there. Okay, this will be external elastic lamina. So my dear aspirants, if you will see this slide of muscular artery, what you can say by seeing this, a well defined circular lumen is there, and tunica media ratio tunica adventitia thickness is 1:1. What is it? If you will see the thickness of tunica media and tunica adventitia is approximately 1:1. So done. Let's see more images. So one more image is there for the muscular artery, where you can see here the tunica intima has been shown very clearly. The internal elastic lamina, beautiful internal elastic lamina has been shown, and a refractile nature, and also external elastic lamina has been shown. So here you can see internal elastic lamina, external elastic lamina, and the thickness is 1:1. If we will talk about the tunica media ratio, that of tunica adventitia. Also generally ye lumen, the lumen is visualized. Generally the lumen of muscular artery is a rounded lumen of muscular artery is visualized when we go for 10x पावर में हम जब स्लाइड्स देखते हैं. एंड आउटर मोस्ट लेयर में वैसा वेसोरम है. व्हाट इज दिस वैसा वेसोरम? वैसा वेसोरम आर स्मॉल blood vessels supplying nutrition to tunica adventitia layer of elastic artery or large muscular artery. Okay, because blood is flowing in the lumen. We know that blood is flowing in the lumen, and by the process of diffusion the outermost layer will also get the nutrition. But if the wall of the lumen is quite enlarged, thickened, तो outermost layer में nutrition नहीं पहुंचता है, तो there is small blood vessel which is giving nutrition to outermost layer of the blood vessels. Now let's talk about the vein. So we have done with this. Now let's talk about the vein. So we have done with the elastic artery, and we have done with the muscular artery. The last structure which I want you to describe is the vein. So when we compare the vein comparatively, vein का जो walls है, that is thin walled in comparison to that of artery. So it will be thin walled. So veins are thin walled, and it contains valves for the unidirectional blood flow. Unidirectional blood flow, what does that mean? That means the blood will always flow from superficial to deep veins. The blood will flow from superficial to deep veins, and when there is incompetency of these valves, it will lead to a condition, clinical condition, which is called as varicose vein. These all points we have already discussed in the general anatomy of blood vessels. Now large vein में क्या होता है? Actually we know that large vein is formed by the joining of smaller veins. So like a river is formed by joining of tributaries. So same concept you can apply on the veins. Okay, large vein is formed by, so when we are talking about large veins, they are formed by joining of smaller veins. Like you can say river is large vein which is formed by joining of various tributaries. Okay, so it is having the valves, and other than that, let's talk about the general features of large vein when I am talking about. So there is not much of difference between the medium size vein and large vein. Tunica intima, if you will see, it is this layer is well developed. Tunica intima is well developed. Also there will be presence of both endothelium, so it will be having both endothelium plus the subendothelial connective tissue. So now individual layer, what it contains is already known to you, so I am just proceeding like this. Okay, if we talk about tunica media, अगर मैं large vein में tunica media की बात करूँ, so when I am talking about tunica media, It is thin, and it is very thin. At times it can be absent also. So one of the important feature of large vein is that their adventitia is 3 times thicker than the media. So media is very thin. Okay, and if we talk about tunica adventitia, it is well developed. It is well developed, thickest coat. It is the thickest coat or the thickest layer, and longitudinal muscles of smooth muscles are running, and large number of, it contains large number of vasa vasorum, large number of vasa vasorum, large number of vasa vasorum. Okay, now सो यस, अगर हम बात करें तो मीडियम साइज वेन में तो बेसिकली द सेम थिंग, ऑल द फीचर्स आर सिमिलर, ओनली द ट्यूनिका मीडिया विल हैव मोर ऑफ स्मूथ मसल फाइबर्स इन द medium size vein. Now see here, if comparative diagram, if you will see of vein and artery, other important point which is there, if you will see the lumen of the vein, it is irregular and collapsed. The lumen of the vein is irregular and it is collapsed. But if you will see the artery lumen, it is circular and well defined. It is circular and well defined. Okay, it is circular and well defined. Now in case of arteries and veins, same layers are there, but in case of artery, generally if we take an example of both large, so अगर हम large vein का example लेते हैं और large artery का example लेते हैं, so tunica media ratio tunica adventitia is 3:1, and tunica media ratio tunica adventitia is 1:3. What does that mean? That means tunica adventitia is 3 times thicker in case of vein, and tunica media is 3 times thicker in case of artery or large artery. Okay, so these are, and also internal elastic lamina and external elastic lamina, these are absent in case of veins. They are absent in case of veins. Okay, they are absent in case of vein. Now let's talk about the next, arterioles and venules. Okay, so what do you mean by arterioles? Arterioles means small arteries. Arterioles means small arteries. So if we talk about its lumen size, approximate lumen is less than 0.5 millimeter. The lumen, so very small lumen sized arteries are called as arterioles. So general features came out. So see here, this is the diagram of arterioles, and you can see here, this is one arterioles which is shown to you, and comparatively one venule is there. So I will have a comparison slide, don't worry. So अगर हम arterioles की बात करें तो tunica intima is just made of, if we talk about its intima layer, it is just made of one endothelium lining. It is not having any subendothelial connective tissue. Media is 1 to 5 layer of smooth muscle. So this will be the media layer, this will be the adventitia layer. So यहाँ पे ये tunica intima है, ये tunica media है, ये tunica adventitia. So all these 3 layers are accumulated there, and tunica adventitia, if we talk about, it is poorly developed. So let's write about arterioles in general. Okay, so write down, arterioles are small arteries. Tunica intima is having only endothelial lining, is having only endothelial lining. It is having no subendothelial connective tissue. It is having no subendothelial connective tissue, no internal elastic lamina. All these structures are absent in case of arterioles. So this was the first layer. What about the second layer? Tunica media. When we are talking about tunica media, it is 1 to 5 layered, consists of circular smooth muscle cells. It is consists of circular smooth muscle cells. And when we are talking about the third layer, that is tunica adventitia, tunica adventitia is thin and poorly developed. Now let's talk about the venules. So let's have a comparative discussion of venules. Okay, so any of the aspirants is having any doubt, please write it. Okay, venules, are you understanding? Let me know. So venules क्या है? Actually it receive blood from the, it is actually exchange of blood vessels. Yeah, hello Hassan Khan, hello dear. So actually the exchange of blood from the venules and that of arterioles occurs via capillaries. So we will move on with the capillaries also. Let me first tell you about venules. So venules are actually, again if we talk about its dimension, so its dimension is 1.1 mm to that of 0.5 millimeter in diameter. Tunica intima is just having endothelium layer. When we are talking about intima, tunica intima is just having the endothelium layer. And tunica media, in case of venule, it is not 5 to 6 layer of smooth muscle, it is just 1 to 2 layer, 1 to 2 layers of smooth muscle. So it is less than, that means thickness is less than as compared to arterioles. And tunica adventitia is thicker. यहाँ पे ये thicker है. When you are seeing arterioles, वहाँ पे tunica adventitia और outermost layer सबसे thinnest था. It is thicker and it is composed of collagen fibers and connective tissues. Okay. So yes, now if we talk about the next important structure which I want you to explain is the capillaries. Now exchange hona hai. Okay, what happens, what is going to happen next? The blood has to be exchanged between the arterioles and that of venules. So arterioles will break down into smaller blood vessels, that is called as capillaries. Okay. Yeah. Okay, Hassan. Okay. So yes, arterioles break down into smaller blood vessels, that is capillary. So exchange, they will act as an exchange vessels which is having a dimension of 7 to 9 micrometers. Okay, so that is about capillaries. So let me come with this types of capillaries afterwards. पहले मैं क्या चाहूँगी कि general features of capillaries के बारे में बात करूँ. Roshni, yes, welcome dear Roshni. So firstly, before coming to that diagram, actually that is a diagram which is giving you the important features of distinction, means what is the important features which is separating the features which is important to know, the distinguishing features from that of the continuous capillaries and that is also called as somatic capillaries, from that of fenestrated capillaries and that of sinusoids. Before that, I would like to tell you in general about the capillaries. So let me give you certain information about the capillaries. So we know that arterioles will break down into smaller blood vessels, okay, and this will be forming the capillaries. Got it? Okay, so it is actually, capillaries are called as exchange vessels because through it only the blood is exchanged between the venules and the arterioles, and approximate dimension is 7 to 9 micrometer wide. They are approximate 7 to 9 micrometer wide. Now, if I in general I talk about the layers, if in general I talk about the layers, in general अगर मैं उसके layers की बात करूँगी, so it is also having tunica intima, tunica muscular, tunica media and that of tunica adventitia. So which is the innermost layer? Tunica intima is the innermost layer. This is just made of endothelial cells. So it is just made of endothelial cells, and these endothelial cells are held together either by tight junction or gap junction. So they will be held together either by tight junction as in case of somatic capillaries, or gap junctions as in case of sinusoids and fenestrated capillaries. Okay. Now, in this endothelial cells, there is a presence of another vesicles. The name of that vesicles is pinocytic vesicle. Very important for you to know that the endothelial cells of the tunica intima, if we are talking about the first layer, that is tunica intima, endothelial cell is containing numerous, it is containing numerous pinocytic vesicle, and these pinocytic vesicles are seen in the cytoplasm of the endothelium. It is seen in the cytoplasm of endothelium cells. Where it is seen? It is seen in the cytoplasm of the endothelial cells. What is the function? They are involved in the transmitting the materials across the endothelial lining in either direction. The transport is possible because of the presence of endothelial cells containing pinocytic vesicle. Other important point is, if we talk about the second layer, which is called as tunica media. So exactly in the tunica intima only we have got. So what happens? There is adventitial cell which is seen in the basement membrane of endothelial cells. So there is the presence of adventitial cells, and these adventitial cells, which is also called as pericytes, these cells, other name of these cells are pericyte, and these cells are present in the basement membrane of endothelium. So that means the basement membrane of endothelium, which is exactly the part of tunica intima, is regarded as tunica media layer in case of capillaries. So these adventitial cell, which is exactly the part, if you go more specifically, it becomes a part of tunica intima, but in case of capillaries, this is forming and constituting the tunica media layer. Okay, what is the function of this? The other point which may Hassan Kam, what is the timing of your session most? So, okay, my dear aspirants, from the month of Feb, I'm extremely sorry for this, Hassan Kam. So, today I am taking 8 p.m. Actually, for the month of January, slightly, I am taking most of the sessions of Future Doctor is 8 p.m. But sometimes I take the sessions in the evening also. Like tomorrow, I think it's 5 p.m. exactly. So, I will let you update all the links, and prior information is given in the group of Let's Crack NEET PG and also in the group of Future Doctors. So, थोड़ा सा evening sessions ही होता है, but at times in the month of January, I have scheduled it at different timings, my dear aspirants, because I have joined the Future Doctor later. But don't worry, from the month of Feb, it will take all the session rightly at a similar time, that you are not getting confused, and systematically I am going to cover the entire course of MBBS course. Most important topic. Please forgive me for this time, Hassan. Okay. So yes, this adventitial or say pericyte cells are containing contractile. These are containing contractile filaments, which is helpful in contraction. What is the function? So they are helpful in contraction, and these contraction effect is important for transmuting the materials in and out from the cells. Okay, the last layer which I want to tell is the third layer. Thank you so much, my dear aspirants and my dear students. The last layer is tunica adventitia, and this adventitia layer is consist of layer of collagen fibers. So my dear aspirants, we have finished with the general discussion of the capillaries. What else I want to describe? The next what I want to describe is the three types of we have got the three types of capillaries. Okay, how many types? We have got the three types of capillaries. So already done with this. So let me just remove this and explain you the three types of capillaries. Actually, we have got three types of capillaries which is found in our body, and I would like to give you the difference of these three types of capillaries. Then I will proceed with the examples, and don't worry, I will write the content also for you. So we have got continuous, we have got fenestrated and sinusoid. See this diagram, which will help you to understand. When we are talking about the continuous, when I am talking about the continuous type of capillaries, which is also called as the somatic type. Okay, जब मैं continuous type of capillaries की बात कर रही हूँ, which is also called as the somatic type. Okay, so in this category, actually in this category what happens, the endothelial cells are continuous in lining. So अगर हम बोलेंगे endothelial layer को, so that is continuous. Can you see any gap? So you can see no gap, no clear cut gap. Only one or two clefts are there, but no clear cut gap is there in the endothelial lining of the endothelium lining of the continuous layer of the capillaries. When you see the fenestrated one, when I am talking about the fenestrated one is also called as the visceral capillaries. The other name is that it is also called as the visceral capillaries. So clearly you can see gaps are there. Fenestration, pores and gaps are lying in the endothelium layer. Can you appreciate? Yes, Hassan, no gap in case of somatic, but in case of visceral, a gap, a prominent gap is there. Okay, gaps are there, and see here clearly, अगर मैं enlarge करूँ तो भी आपको दिख रहा है. Can you see this visceral or fenestrated? So I'm just concentrate on this. So see here, there is gap. So see here, there is a gap, there is a gap, there is a gap, there is a gap, there is a gap. So a prominent gap is there, and these are called as pores. What is it called? These are called as pores, which is present in the visceral or fenestrated capillaries. Okay, these are there is pores present in the endothelium. So इस case में क्या होता है? Pores are present in that. So this will be more permeable. That means if we compare the permeability of somatic capillaries with that of fenestrated, which one is more permeable? Fenestrated capillaries ज़्यादा permeable होगा. Okay. So pores are often having a thin diaphragm, and these diaphragms are letting sometimes to pass the macromolecules also. When you see the third one, which is having a wide gap, this is called as sinusoids. Okay, these are called as sinusoids. Okay, these sinusoids are present in liver, it is present in the spleen, and there is gap in the endothelium. See here, prominent gap in the endothelium. Not only that, can you see the gap is also residing in the basement membrane. So here the gap is in the endothelium, and also the gap is in the basement membrane. So it is highly permeable, and capillaries which is having irregular lumen, having gaps in the endothelium lining, having gaps in the basement membrane. So these kind of capillaries are found in liver, hemopoietic organs, red bone marrow, and that of spleen. So let me write it for you so that afterwards you can revise and will not forget. So let me write the 3 types of capillaries. So one by one I will explain which was the first type. The first type is continuous. So have you understood that difference? Let me quickly write it for you. Continuous or somatic capillaries. Okay, जब हमने बोला continuous or somatic capillaries, this is the common type. Thank you. Okay, so everyone has understood. Okay, Rosni. So it is actually the most commonest type of capillaries which is present, commonest type of capillary which is present. And here in this case, the key feature is that endothelium cells forms a continuous layer. Yes, Hassan, continuous layer in capillary. So it is a continuous layer. There is not a prominent gap visible there. Examples are important which is asked for your Viva exam and for your MCQs. It is important for your MCQs and for your Viva exam, for the first Prof exam, that you should know this MCQs and Viva ke liye example. These kind of capillaries are present in connective tissues. This is present in connective tissues. This is present in brain. This is present in lungs. This is present in muscles. Okay, these are basically examples of continuous or the somatic capillaries. So let's move on to the second type. The second variety of capillary is, okay, so let's move on to the second type. Second category of capillary is the fenestrated, which is also called as the visceral capillaries. Fenestrated or the visceral capillaries. Okay. So here if we talk about its general features, pores are present. So pores are present in the endothelial cells of capillary wall. Okay, and these pores often get covered or closed by a thin membrane. This thin membrane is called as diaphragm. So pores often get closed by a membrane, and these membrane, what is this membrane called as? These membranes are called as thin diaphragm. Yes, absolutely right, Hassan. Thin diaphragms. Absolutely correct, Hassan. Thin diaphragm. Okay. So here what happens, through this sometimes macromolecules can also pass. Okay. Examples. If we talk about examples, which is very important if you are targeting your MCQs. Yes, Hassan, you are absolutely right. MCQs or Viva के लिए हमें क्या जानना है? Examples of fenestrated. Examples of the fenestrated or visceral capillaries. The examples are, it is found in kidney, it is found in intestinal villi, glomerular capillaries, it is found in endocrine glands. Now which is the third variety? The third variety is sinusites. The third variety is sinusites. So let's talk about sinusites. So let me write here itself the sinusites, that is the third variety. Okay, so when we talk about sinusites, sinusites is found in liver, actually hemopoietics organs में ये found out होता है. It is found in spleen, it is found in liver, it is found in bone marrow, red bone marrow, and spleen and liver. Liver में Kupffer cells में ये find out होता है. Kupffer cells in the liver, it is found in the Kupffer cells in the liver. These are the examples. So firstly only I have given the examples here. So these are the examples of sinusites. Okay. So it is having these, this is having an irregular lumen. इसमें क्या होगा, एक irregular lumen present होता है, highly permeable होता है. Irregular lumens are approximately of dimension of 30 to 40 micrometer. The discontinuous, and it is having discontinuous, other important point which you have to note down, that it is having discontinuous endothelium along with it is having discontinuous basement membrane. So it is having discontinuous endothelium, and we know that endothelium is resting on basement membrane, so it is also having basement membrane. So these two structure, both endothelium and basement membrane, are discontinuous. And examples are, it is found in liver, red bone marrow, hematopoietic organs, liver के Kupffer cells में और spleen में we get sinusites. Okay, so these are the structures where we have. So with this explanation, it is known that the most permeable will be the sinusites, then the fenestrated capillaries, and then the somatic capillaries. So आज का जो सेशन था उसमें हमने आइडेंटिफाइंग फीचर्स देखा इलास्टिक आर्टरी का. द डिफरेंस ऑफ इलास्टिक आर्टरी एंड मस्कुलर आर्टरी इज दैट द elastic artery is having internal elastic lamina and external elastic lamina, but it is not clearly visible in the histological slide. Muscular artery में internal elastic lamina, external elastic lamina is visible because elastic fibers are less in number. Other than that, the thickness of tunica media layer is 3 times that of tunica adventitia, but in case of muscular artery, the thickness of tunica media and tunica adventitia is 1:1. When we are talking about the vein, which is the thickest layer, anyone who have attended, thickest layer यहाँ पे क्या होगा, tunica adventitia होगा. Maximum number, if I talk about the point, that is maximum number of vasa vasorum. What do you mean by vasa vasorum? Vasa vasorum means small blood vessels which is giving nutrition. These are small blood vessels giving nutrition. Yes, absolutely right, Roshni. Nutrition to the outer layer. What is the outer layer? The outer layer is tunica adventitia. So maximum number, if you will ask me maximum number of vasa vasorum, it is present in large vein as compared to large arteries. Okay. So large vein का मतलब superior vena cava, inferior vena cava. So actually the blood which is flowing in the vein is very sluggish. It is having irregular lumen and the blood flow is also sluggish. So because of that reason, the nutrition which is provided to outermost layer of the tunica adventitia is not possible. So large number of vasa vasorum will be present in case of vein as compared to artery. If we compare the large vein, so maximum number will be present in large artery as compared to large vein as compared to large arteries. So yes, we have done with this. Before ending the session, I would like to give you few important important information. One is high yield anatomy MCQ series which will be taken for the NEET PG 22 examination. The students who are interested can join me for the free session on Wednesday, Republic Day ke din, 26 January, 1 p.m. and 3 p.m. session, free special sessions. The students who are watching the session for the first time, they can use the code ANAT10 to unlock my free session and be present live for this session. 2 sessions are there on Wednesday, 1 p.m. and 3 p.m. Now, I would also like to discuss the free calendar chart for the NEET PG for the NEET PG test. Okay, all these, so I just want to highlight this. You can enroll in these tests by using the code ANAT10. So just use the code ANAT10 and enroll in all these tests. Okay, these tests are highly beneficial for you. If you're Hassan, thank you so much. I'm so glad. Thank you. Okay, anything which you need, any new topic you want me to study, don't worry, I will come up with the entire timetable जो मैं पहले ही circulate करूँगी Feb month में. So we will go more systematically. Meanwhile, many students will be coming on the platform because students will take admission in the first year. So we will have a more systematic view and I will cover the entire course in a very systematic way. I will let you all about when is the timing, what are the upcoming sessions coming up. Okay. So yes, these are the whole details of the free test of the calendar which is going to happen. And if you want to be present live for the session, please my dear aspirants, my dear students, just enroll by using the code ANAT10. This will be highly beneficial and it is on the free platform. So please grab this opportunity and be present for these tests. This will help you to acquire a better rank in the examination. Okay, my dear aspirants, I would also like to tell you about a special offer which is going to because of the Republic Day, and so I'm very glad to share this information with you that you are getting 6 months of free extension if you are going to take the subscription of 1 year and above plus subscription. अगर आप 1 year और above का plus subscription लेते हैं on the date of 25th tomorrow, day after tomorrow, like 25th, 26th and 27th, this is the Republic Day special offer. You will get 6 months of free extension along with 1 year of more of the plus subscription. You can use my code and get an extra discount of 10%. So this is a huge discount which is going on. If you are planning to take the subscription, this is the right time. Go for it and take the subscription. Use my code for getting extra 10% discount. So 3 days है जहाँ पे आप extra 6 month का subscription avail कर सकते हैं. So go for it. Now, this is the pricing detail of Plus and Iconic has been compared. Have a look on this and you can avail an opportunity of discount by using the code ANAT10. Thank you, all the best, and we will again meet with the special class, and tomorrow also I will take a session for future doctors and Let's Crack NEET PG. So do like, subscribe and share the Unacademy Future Doctor channel. All the best, keep studying. I will come up with the new sessions and be studying. So let's end the session. Hope this session is useful for you. Thank you, my dear aspirants.